Okay, this is great. We have a lot of questions, so I'm going to start with the first one. Why do some blepharospasm patients, why are they able to stop their spasms when they're looking up but get severe spasms looking down?
Actually, as I mentioned in my presentation, most patients with blepharospasm, they have less spasm when they look down and more spasm when they look up. Sometimes it's the opposite, but in most cases, it's when they look down that their blepharospasm is relieved. Why that is really not that clear, but when they look down, they are less likely to contract the orbicularis oculi muscle, and therefore they have less involuntary contraction. So that's probably the reason, but I don't think anyone knows for sure.
I like this question, Dr. Hallett. Who might be the leading doctor here in Pittsburgh area? That's me. No, I'm kidding. I
think it must be Dr. Sekula, and he must have asked that question himself.
I can give you a list of doctors for particular conditions, both in the UPMC system and on the Highmark side, so just catch me at any time. What causes double vision? Who asked that question? In relation to what?
It's probably botulinum toxin.
Yeah. So patients with blepharospasm usually do not have double vision. But when patients with blepharospasm have double vision, the first question I want to ask, when was the last time you were injected with botulinum toxin? Because one of the side effects of botulinum toxin injection is blurring of vision or double vision, as well as droopiness of the eyelids, and I'll talk about it in my presentation, botulinum toxin. So blepharospasm itself should not cause double vision. If there is double vision, there's usually another reason for it, such as botulinum toxin injection or some other brain or nerve problem.
Let me just make one more comment about it. Double vision comes from the fact that the two eyes are not properly aligned with each other, and botulinum toxin may cause some weakening of the eye muscle so that the eyes go out of alignment, and so each eye is seeing something slightly different because they aren't aligned. If you have the double vision, if you close one eye or patch one eye, then you'll only see single, and that might be a way of dealing with the double vision. If you have double vision with one eye, that's a completely different situation. That's very rare to have monocular diplopia, as it's called, or monocular double vision. Most double vision is from the two eyes being out of alignment.
Do you believe physical therapy for the neck is beneficial in helping cervical dystonia?
So this is somewhat unrelated to the main topic of blepharospasm, but clearly physical therapy is useful in patients with cervical dystonia, especially in maintaining or even improving the range of motion. When we first started to use botulinum toxin for patients with, let's say, with cervical dystonia, many of them had twisting of the neck or tilting of the neck, and they had what we refer to as contracture, shortening of the tendon. That obviously cannot be fixed with botulinum toxin. That we almost never see now because patients with cervical dystonia are diagnosed early, are treated early, so we tend to prevent contracture. But nevertheless, physical therapy is a very important ancillary treatment to further improve the range of motion.
Is there any relationship between trigeminal nerve pain on the right side of the face and blepharospasm?
Let me just say very quickly about it. I did and one of my slides talked about the fact that there are some patients with hemifacial spasm who also have a condition called trigeminal neuralgia. That combination can occur when the abnormal blood vessel compresses not only the facial nerve, but also the fifth nerve or the trigeminal nerve. So patients may have both pain that is typically seen in trigeminal neuralgia, such as shooting electric shock-like type pain, and also hemifacial spasm. And so that combination can occur.
But I think the question is with respect to blepharospasm, and that goes back to the point that I was making. I think that these melanopsin cells connect to the trigeminal nerve, so that there is a potential combination between light influencing the melanopsin cells getting into the trigeminal nerve, and the pain that is felt in photophobia might be a trigeminal pain, and that's the sort of relationship between blepharospasm and trigeminal pain.
I have heard that BEBRF wants brain donations at death. Will this cause a conflict with anatomical donation? If so, is there a remedy to the conflict? Can BEBRF help with this?
Right. So as I pointed out in my talk, there have only been a few brains that have ever been looked at in relation to trying to understand the brain pathology in people that have blepharospasm. So it is extremely valuable to have brain donations to try to identify what the pathological abnormalities are. And there are more sophisticated methods that are available now for looking at brains to see if we can find something that is the matter, and if we can, that will be extremely helpful. So brain donation is a very valuable thing to do. BEBRF, like the other dystonia organizations, has teamed up with the Harvard Brain Bank to be the sort of central place for all these brain donations to occur. Any other purpose for brain pathology can be studied in the same time. So if there's any other type of reason for making a brain donation, it can be simultaneously looked at through the Harvard Brain Bank. So BEBRF and all the other dystonia organizations are strongly advocating that people do have brain donation, and the central place for that now is the Harvard Brain Bank.
These are all great questions. So
could I just add another comment to that? Dr. Hallett talked about the importance of looking at some kind of a pathology in patients with blepharospasm, look at the brain. But perhaps even more important is also looking at the biochemistry to see if there are any abnormalities in neurotransmitters. And I just want to give you a brief anecdote how that might be helpful. So many years ago, I had a patient who had blepharospasm. She wanted to donate her brain. She was unfortunately diagnosed with ovarian cancer, and a few hours before she died, she asked if she could be admitted to the hospital so we can collect her brain. While she was in a hospital, she unfortunately passed away, but we were able to collect her brain immediately within a few minutes after she died, and analyze that brain biochemically, because you cannot analyze brain biochemically if it's long after the patient dies. And we actually found very interesting findings that we reported in the New England Journal of Medicine, showing abnormalities in not only in dopamine but also norepinephrine. And I'm using it as an example where an examination of the brain, when it's done properly and timely, can be extremely valuable. Unfortunately, fortunately, unfortunately, depending on how you look at it, we have very, very few brains that have been examined that way at autopsy.
I'm going to go till 10:20 because there's so many good questions, and then we'll keep trying to get through them as the day goes on. I get ptosis frequently in my left eye. My doctor said Medicare will not approve surgery unless it is in both eyes. Comments, please?
Okay, so again, ptosis is not a feature of blepharospasm unless the patient is treated with botulinum toxin and it's a side effect of botulinum toxin. So that I can deal with this question offline because this is a more sort of administrative, medically administrative issue, right, and medical issue. So I'll be happy to talk to this individual about it.
Will research be considered on the effect of marijuana on calming spasms and blinking?
Okay, so let me just make a comment about it because I just submitted an article on marijuana in movement disorders, not based on my own personal experience, of course, but I have a son who lives in Denver. Nevertheless, a lot of my patients, if they are honest with me, and I hope all my patients are honest with me, they tell me that when they smoke marijuana, their blepharospasm gets better. There has not been a study on marijuana in blepharospasm. There have been studies on a number of other conditions, including Tourette syndrome, folks that I mentioned. But at this climate, both political and other kinds of economic climates, it's very difficult to do a study with marijuana. Nevertheless, I think you're going to be hearing more and more about it because there are some new studies that are coming out shortly.
I want to remind you this marijuana is not legal in this state, Dr. Jankovic.
Right, right.